Very good. Well, it's a great pleasure to have Stephen Mullin as the next speaker. Stephen and I have been working on this for about 5 years now, I think. And Stephen had the great idea of getting people where they are most comfortable, i.e. at home, and to participate in the Rapsodi study. So, Stephen, we've heard about Rapsodi, but you're going to talk to us about something slightly different now as well, in terms of how we're going to try and use the study and move towards some targets for treatment. Thank you.
Well, thank you, Tony, and thank you everyone for taking time out on a Sunday afternoon to come and see us. We very much appreciate it. It was funny when I was asked to do a talk at this event, because I was sort of minded back to, well, first of all, when I actually first entered Tony's office as a much younger doctor trying to get a PhD, and I remember the first thing I said to him was, I want to do a PhD developing a treatment for Parkinson's, and he sort of laughed me out the room, basically, because at that point there just wasn't really anything anything sort of which vaguely looked like it might be potentially promising in that field. And actually 2 years later the field had completely and utterly changed. And the other thing I was minded of was when I went into Tony's office and actually came to him and I said, look, I've got this idea, which, by the way, I wasn't entirely my own. I sort of stole it from a project called Predict PD. But I said, I've got this idea that we can start assessing our GBA carriers over the internet. And we were sort of coming up with names, and we came up with this name, which was Remote Assessment of Parkinson's and Supporting Ongoing Development of Interventions. And the sort of bit about interventions, i.e. drugs, was a little bit aspirational, really. And I didn't think realistically that there would be anything on the horizon, sort of certainly for at least a kind of decade or so. But actually that's not the case at all. And actually the field has moved so fast that, there really is lots and lots of very promising studies and compounds in this kind of area. I guess I'm just going to start by recapping why I'm so sort of optimistic about the prospects of interventions in this field. And the reason is just the scale of the number of people who carry GBA mutations. So this is a diagram of the number of people worldwide with Parkinson's disease who carry a GBA mutation. So actually in Western Europe it's around about 5%, and in Israel it's actually about 20%. And actually in North London, because of the sort of nature of the population we have here, there's lots of people with Ashkenazi Jewish heritage, the rate of GBA mutations is a bit higher. And the reason that's important is basically the bottom line, which is that pharmaceutical companies are interested in drugs that have a wide market. And Parkinson's disease is a very common disease, and there are lots of people who carry mutations in these genes, which means that there is an awful lot of interest from the pharmaceutical industry in developing drugs to try and treat both Gaucher disease and Parkinson's disease, which is caused by the GBA gene. And just to reiterate that point, in terms of people who don't have Parkinson's disease in the UK, well, about 1% of the UK population will carry a Gaucher-associated GBA gene mutation. So that's to say a gene, a mutation which has been described in somebody with Gaucher disease. But about 4% of the UK population will carry a GBA mutation that's not necessarily a cause of Gaucher disease, but is implicated in Parkinson's. So seems to in some way influence your chances of developing Parkinson's disease. And so once again, this is just to emphasize that there is a really big market for this, which means the pharmaceutical industry is interested and are spending a lot of money as we speak trying to develop new drugs and new strategies to try and treat both these conditions. And the key point is this, and this is a bit of a repetition, but basically it has been shown that in the 10 or 20 years in the run-up to somebody getting Parkinson's disease, there are various slightly non-specific symptoms that can identify potentially that somebody is on the way to developing Parkinson's disease. And the idea is that if you can narrow it down, if you can try and get an idea of what the profile of the person who carries a GBA mutation who will develop Parkinson's disease is, you can potentially give them drugs in advance of that happening. So stop the development of Parkinson's disease altogether. And the key point, but the thing that makes it really, really hard is this. If you carry a GBA mutation, you are far more likely not to develop Parkinson's than you are to develop Parkinson's. So using the sort of best quality studies that are available at the moment, if I take 100 people who carry a GBA mutation, about 10 of them will develop Parkinson's by the age of 80. But actually, we have reason to believe that it's even lower than that. So it may be 5 or even less than that, for various reasons that I can go into if anyone is interested in. And the other thing is, we don't really have any idea which people those will be. It doesn't seem to be just the particular mutation you have, although that certainly influences things. There seem to be lots of other factors that are implicated in it. And in order that we are able to find out what there is a need to have research with lots and lots of people, because that's the only way that you can try and establish with a degree of statistical significance, that's to say, to be sure that it's actually not just by chance, that what the factors are that influence who is going to develop Parkinson's disease. And just leading on from that a little bit, so this is the genetic code of the GBA gene. Each letter is what's called an amino acid. So we have good information on probably the two commonest mutations that cause Gaucher disease and Parkinson's disease. One's called N370S and one's called L444P. But there are in excess of 800, and Darylyn might correct me because there may well be more now, 800 Gaucher-associated mutations. And to be honest, we have very little working knowledge into the vast majority of what those mutations mean in terms of your risk of Parkinson's disease. And it's only by having a big study with lots and lots of people and following them prospectively, so following them over the course of a number of years, that we are able to discover that. And I guess the thing that is important about all these facts is that this knowledge and this information will feed into the design of drug trials. So the design of trials which are looking to see if you can have a slowing down or a stopping effect in Parkinson's disease, but also potentially in Gaucher disease as well. And it's only when you really understand how a disease behaves that you can design a trial so that it has the best chance of working. And unfortunately, there are plenty of drug trials which have failed just because there wasn't a good enough understanding of how the disease behaved. And what we don't want is a situation where we get all the way and a really promising drug comes to the point of a clinical trial and it fails because we just don't know enough about the disease to be able to design the trial appropriately. So I'm going to talk a little bit about the specific kind of ways that we think that we might be able to influence the progression of Parkinson's disease and how that might be done. But before I do that, the thing that is really nice working so closely with Darylyn and haematologists and other metabolic medicine doctors is that they are so ahead of us. So I'm a neurologist. I'm a doctor who is used to treating problems of the brain and the peripheral nerves. And unfortunately, neurologists, certainly up until a few years ago, really didn't have very much in the way of treatments that actually were able to improve people's lives, were able to slow down the progression of diseases. That's changing a little bit, but it's in stark contrast to haematologists, who, on the whole, deal with diseases that they're able to treat. And Gaucher disease is a really excellent example. It was a disease with a pretty bad prognosis, with not very much to be done apart from removing somebody's spleen, and then all of a sudden, these raft of new treatments came out and they've completely transformed patients' lives. And it's really exciting to be working both with people who have had the get up and go to be able to do that, but also in a field where it looks like a lot of the same mechanisms might be relevant in terms of Parkinson's disease. So that's to say that a lot of the same drugs and a lot of the same kind of things that the drugs do might have an effect in Parkinson's disease. And that's really where we are in terms of drug treatments at the moment. These are drugs which on the whole are designed to treat Gaucher disease, which also look like they may have some benefit in Parkinson's disease. And so that's kind of where we are at the moment. And so there's three classes of drugs that are really being used and are being tested at the moment. The first of these drugs called substrate reduction therapies, and these are drugs that reduce the amount of the fat that builds up in Gaucher disease. And these drugs have been used with a lot of success in Gaucher disease, and there is some evidence that they may be of use in the context of Parkinson's disease in patients who have a GBA mutation. And actually, Professor Shapiro is the global principal investigator of a study which uses one of these drugs, which we'll talk about in a moment. The next class of drug is a class of drug called molecular chaperones. And these are a class of drugs which basically try and modify the structure of the protein or the enzyme which is responsible for sort of clearing out the dustbin using the analogy that Derelin was using. And basically, these drugs bind to the protein and they change the way it works so that hopefully it increases the activity of the enzyme, referring back to Professor Shapiro's talk, and then hopefully will enable the process that is leading to the development of Parkinson's to be slowed down or even stopped. And the final strategy that's being used is gene therapy. And that's to say, using various techniques to try and modify the DNA, which is actually abnormal and is leading to the increased risk of Parkinson's disease or Gaucher disease. And again, this has been a field of research in Gaucher disease for best part of a quarter of a century, and it looks like really they're getting to the point where actually some of these treatments may be able to actually work very well. And I can't tell you about them because it's confidential, but I do know that a number of major pharmaceutical companies are working on drug trials in this area. And just as an example, this is a study which is recruiting at present called MOVE-PD, and this is a trial which is using one of these substrate reduction therapies. And this is a study that's costing in excess of $50 million. So you can see that the drug companies really are investing quite heavily in the prospect of these treatments actually having some use in the context of Parkinson's disease. And going by sort of the description I've given it, it does feel a little bit like it's one-way traffic in that the Parkinson's disease field is taking all the research and expertise that's come from the Gaucher disease field and is using it to try and treat people with Parkinson's. And that is sort of what is happening at the moment. But the flip side of it is that Gaucher disease is quite a rare disease, whereas Parkinson's disease is an extremely common disease. And the fact that there is very good evidence in the lab to suggest that these treatments might have, and this pathway might be relevant in Parkinson's disease, and the amount of funding and effort that's going in to try and develop these trials, means that actually the hope would be that in years to come, that the traffic might work the other way. So actually drugs that are developed for Parkinson's disease might be used to go back the other way and might help people with Gaucher disease. And especially in the context of people who have neurological symptoms of Gaucher disease, which at present we don't have much in the way of good treatments for. Because obviously Parkinson's disease is a disease of the brain, and so there is a good chance that some of the mechanisms that underlie it might have relevance in those with neurological symptoms of Parkinson's disease. And although all the drug trials I've mentioned are primarily in the context of people who already have Gaucher disease or already have Parkinson's disease at the moment. There is substantial interest and definitely a realistic prospect of these drug trials being in people who have the GBA gene but don't have either one of these diseases, in order to prevent them, in the case of Parkinson's disease, getting them all together. And that really would be the hope, that actually if we are able to find one of these drugs that is able to work in early Parkinson's disease, then we might be able to use it to stop people getting one of these diseases altogether. Which is why your involvement in this study and your continued commitment to giving up an hour a year to doing this and doing the smell tests and being part of the study is so important, because really it's going to be ever so important to have a group of people who we know carry these mutations, in order that we can provide the people in these drug trials to try and test these new treatments. So in summary, well, we think that Rapsodi will increasingly become a platform for the selection of those with GBA mutations for clinical trials. We know already that the information gathered from research into GBA carriers is informing, and hopefully will inform, the design of those future clinical trials, so that we can make sure we design a trial that has the best chance of working. I think initially all of the trials are likely to be in those with Parkinson's, but the hope will be that very soon they may start to be shifted towards those people who have these mutations but haven't yet developed Parkinson's, but are, we consider, at high risk of doing so. And we also hope that there will be an interplay between these two diseases, and actually the fact that people with Gaucher disease and people with Parkinson's disease seem to be caused by mutations in the same gene will be to the mutual benefit of both diseases. So that's everything from me. Thank you very much.